Good morning. I would like to take this moment to thank everybody for joining us for our December Learning Lunch Webinar presented by EMRapproved.com in association with the ForMed Healthcare Training and Certifications Program and Engage Me HIT. My name is Wendy Whitmore, and I am the CIO for EMRapproved and ForMedProTraining.com. Today I am joined by Cherie Lester, the Senior HIT Recruiting Professional and popular industry blogger and author of our new HIT Recruiting course at ForMed Pro Training. We'll be presenting an introduction to hiring strategies of the elusive beast that is the HIT and technical professional into healthcare environments. Because we are often asked this question throughout the session, I will announce now that we will record this session for our YouTube channel, and we will deliver that link along with the PDF slideshow to all attendees and registered visitors. Feel free to type questions as you think of them throughout the session, and we will address them at the completion of the presentation. We will also open up mics as needed for more detail, and if you'd like to ask a question live at the end of the session, use your hand-raising button on the dashboard, and we'll open up your mic. Other than that, I think we will plan to utilize the chat function or the questions function on the left. Okay. I'm going to start this session by explaining why we chose this topic for our December Learning Lunch. Firstly, the ForMedTraining.com program just launched its new healthcare hiring professional certification program, for which Cherie was a primary author. This got us talking about the fact that hiring strategies are not limited to the HR and recruiting industry, but are also necessary for the employers themselves in many cases. So we thought it might be helpful to engage a broader audience in the discussion of how to best approach this unique set hiring challenge. We thought it helpful to have both of us present in order to offer up perspectives from employer in healthcare as well as a professional in the industry. And of course, the professional is Cherie, and I am a frequent employer in the healthcare space, both for my clients and for my business as well. So we're going to start by talking a little bit about the challenges when seeking health IT staff. Did you need us? The challenges are many and varied when you're looking to hire HIT professionals into the healthcare universe. I know that, as I mentioned, from first-person experience. In fact, I apologize, I just had one of my new hires just pop his head in because he didn't realize I was presenting a webinar today. These folks are largely incredibly skilled and knowledgeable in their specific arena, but because the industry, the healthcare industry, is very fragmented with for over 500 complete EMR solutions and various modular versions, as well as cloud solutions versus server-based solutions. There are diverse roles in every given technology department which require multiple skill sets. These are very common challenges when looking to hire healthcare information technology professionals. Knowledgeable tech professionals that have a background in healthcare are also difficult to find. Cherie and I were talking about that this morning. People don't realize that there is an overall shortage of 50,000 HIT workers in the industry right now because with the HITECH Act and with the rollout of incentives and future penalties for electronic medical record implementation, obviously this has pushed up the requirement and the necessity of technical folks in the industry. So because of that, there's a rather unique shortage in this particular industry, and lots of groups are trying to get people up to speed, trying to help people cross over from traditional business industries and technology to healthcare, and subsequently that's presenting a pretty significant challenge. Salaries are higher than for other professions. That can be a unique challenge for certain employers, obviously, where you might be accustomed to hiring at a particular salary range or salary level. You might find, that the the salary requirements of these professionals with their skill sets is very high. Additionally, technology professionals tend to be a unique group across the board. Again, I've owned a technology company with technical consultants in my employ for over 15 years and have been in this industry for even longer than that. And subsequently, I'm familiar with the fact that hiring personalities that fit from the technical universe across to the clinical universe is sometimes also challenging. And then interviewing candidates for these types of position requires a certain amount of technical knowledge. So in other words, what is the basic understanding of technical requirements? Those detailed pieces of information are difficult for healthcare employers. This is not an area that they're necessarily familiar with. So when I start to think about, from an employer's perspective, when I start to think about some of the challenges in seeking HIT staff, these are my sort of high-level challenges. Hopefully everybody's able to hear me. I seem to be receiving a few text-based questions commenting on the audio. If that is continuing to be a problem, please let me know. So how do we address the fragmented industry issue? And when I say fragmented industry, what I mean is not only are there over 500 EMR solutions on the market, but there are also many versions of implementation of electronics in the industry. Some client sites and hospitals will have multiple servers on site, others will be engaging vendors in an off-site server solution. Many medical practices are using cloud-based solutions. It just, it runs the gamut from a technology standpoint. So one way to address the fragmentation in the industry is to begin by listing your entire portfolio of technology needs. And essentially what you want to do in that regard is to take a look at, if you're new, if you have a new implementation of medical records or digital solution in your environment, one thing you want to do is to identify what those independent needs are for each aspect of that implementation. If you have been up and running in a digital format for a year or so, a good way to figure out what your high-level technology needs would be to go back through your money's spent on technology over the past year. I find that a good exercise anyway, and in December is a good time to do it. Look back at from the beginning of the year through now to see what you've spent. Have you hired technical consultants? Have you brought in, have you spent a certain amount on your internal staff in your hospital department? Are you engaging consultants or short-term project assistants in that regard? If so, essentially what you want to do is take a look at all of those costs for the year and take a look at all of those requested industry needs throughout the year. What did you need help with? Did you budget a certain amount for the actual implementation? Have you required a lot of technical support? Identify within that list your highest priorities. What costs the most money, for instance, from consultants? What caused the most difficulty in your environment? Were you down at any point? Was broadband a problem? That sort of thing. Anticipate any new product implementations that you're planning in the new year. So let's say you've rolled out a medical record in your environment, but now this year you're going to be incorporating the use of medical devices that link with that product or solution. Something to keep in mind as you're starting to think about who you're going to hire into these technology roles. Review your internal talent. We don't always, as employers, understand everything that our employees are capable of doing. I'll give you a quick example. My 12-year-old son was taking guitar lessons with a wonderful young musician named Evan, who's actually here today. And Evan was an excellent guitar teacher, but he overheard me interviewing some candidates for technical positions on the phone from home, and he asked me what I did for my work. And ultimately, Evan became one of my best technicians. Now, it would never have occurred to me to ask Evan if he was a computer technician, because of course he was a guitar teacher, and he had told me that he was studying musical engineering at the university. So one thing that you can do is take a look at your internal talent pool and re-interview them, even if they've been with you for a while, and find out if perhaps they might have skills, technical skills, that you're not even aware of. Particularly young people, you'll find, have cross-trained and learned a lot about technology just by virtue of the fact that they've been embroiled in it since they were children, different from my generation, of course. Also consider some internal training options. As I mentioned, I am CIO for famliarize.com, which is a component division of EMRapproved.com, where we provide some training to folks to help fill gaps in their HIT skill sets. Additionally, there are all kinds of programs out there, the HIT Pro program from ONC and things like that can help. So if you find an internal base level of skill, you might be able to cross-train them in some technical capabilities. Ask colleagues for referrals. Folks who work in healthcare and also in technology are so rare and so far and few between. One way to get some good referrals, for instance, for short project work or for consultants, is to ask colleagues in the healthcare field to help you find some folks. The other piece is, if you are actually looking for FTEs, full-time candidates, with HIT capabilities, be sure to interview these people extensively. Bring in numerous candidates. And alternately, if you're not doing internal interviewing, or if you don't feel comfortable selecting somebody with high level of technical skill, if you have limited understanding of what those requirements might be, this is also a time when you might consider hiring a skilled HIT recruiter. HIT recruiters, folks who understand healthcare and technology, are also a smaller bunch than recruiting in the universe in general. And so in order to find a skilled HIT recruiter, I can direct you in numerous ways, but at EMRapproved.com in our marketplace, we actually have a complete category that is just about employment professionals in HIT, so you actually could find somebody to help you that way. But regardless, if you're going to interview yourself internally, make sure that you have a good base knowledge of healthcare technology yourself, or somebody in your group who can help you interview that can ask the right questions. Another challenge I mentioned was the diverse skill sets issue. One of the problems that we have in hiring HIT professionals is that they have a really insane level of understanding on a lot of different topics in technology. So what you might find is that you have applicants or candidates who have a lot of strength in, for instance, server support or a specific electronic medical record support, but they're lacking in other areas. What you want to do in that case is you want to make sure that you're listing your needed technical tasks in order of priority. Very rarely are you going to find the one guy or gal who has every single skill set from a technical standpoint that you need in that individual candidate. So your first order of business is to list the technical tasks that you feel you need in your environment in order of priority, and start to look for candidates who fill the top part of that list. You can always, you can always backfill knowledge gaps for lower priority items, but you want to be trying to fill that HIT role at the top of that queue. You want to discuss needs with other staff in that department or in your environment. If you are the owner, operator, manager, employer, and this person that you're hiring is going to be working with other folks in a department or in a practice or clinic, you probably want to talk to that staff about what their high-level needs are from a technical standpoint. You want to review the positions that you've already filled, make sure that you're not duplicating skill sets. So if you've already got somebody that's really strong in server support, you might want to start looking for somebody to fill the alternate items in your technical task list. Do yourself a favor and identify the most difficult skill set in that list and look to interview to find the person that can fill that need. That is certainly one approach. And then we'll talk about, another way to approach it down the road here in terms of challenges. And then investigate vendor training costs and options. So, for instance, if you're going to hire somebody who is a really strong technician, but they don't know your EMR specifically, you're going to need to sort of bake into your cost expectations that charge to your budget of training them in that specific medical record solution. And then additionally, reviewing training options for secondary skills. So if this person comes in and they have a really strong clinical background, really strong EMR skills, but they're a little light in certain areas of project management or something like that, you might want to investigate the costs of some of that gap training for secondary skills. Another issue in hiring in HIT is the healthcare experience issue. You might be able to find a rocket scientist in technology, but they've never been near or been familiar with or been embedded in a healthcare vertical. So that can be challenging. In other words, as you all know, you're coming to this event largely from the clinical community. If they don't have a background in healthcare from a clinical standpoint, this can be relatively challenging for them to get up to speed on the unique needs and issues relevant to healthcare environments. So make sure when you write your employment ads and job descriptions that you are looking for folks with some kind of familiarity with clinical environments. Again, you can request regional recommendations from your EMR vendors so that they understand that you're looking, and they can potentially point you in the right direction to folks who have the right skill set for your digital environment. You can consider similar industries or work environments in the applicant history. So if you're getting no applications and no candidates coming to you with any kind of healthcare background, that is something that you can cross-train in, obviously. It just takes a little bit longer to get them fully up to speed. You can engage the internal staff in the interview process to help figure out which of the candidates is a better fit. You can also ask pointed questions that are healthcare specific. So if you have an inkling that somebody is, bumping up their resume, if you will, and perhaps suggesting that they have more experience in healthcare than they really do, you want to, from a interview standpoint, you want to be sure you're asking pointed questions regarding, things like HIPAA and standard medical record workflow, and then you can focus on choosing a candidate that has excellent skill and a good personality, and then cross-train them in healthcare. That actually, interestingly, it's a lot easier to train a skilled industry technician in the healthcare environment, in the uniqueness of the healthcare environment, than it is to try to train somebody who's clinical as a technician. So, you obviously have both choices available to you, but that last bullet is going to be a little easier than other choices you might make. The high salary issue, I don't know why I chose this photo. It just looks like he's going to demand a high salary from me. Anyway, the high salary issue is a big issue in HIT and in technology roles specifically. I know that from personal experience, and many of you probably know that from prior hires. One thing that you want to do to address the high salary issue as a challenge, is to create a summary of existing technology staffing costs. So we talked about that a little earlier. Take a look at your budget for the year. What did you pay out in technology costs, either from consultants or internal staff or short-term project work, implementations? What dollars did you spend on technology in the past year? Review proposals from outsourced service companies first before you hire. You may find that if your technical needs are limited, that you could potentially outsource some of that technology service. There are lots of managed service provider companies that have healthcare experience, etc. And that might be less expensive because, quite frankly, they can log in, solve a lot of your issues and problems, and they can, have a high-level understanding of your business, but they're not underfoot. They don't require, full payroll and benefits necessarily, and so, it's worth reviewing it. You may find that when you look at that proposal extrapolated over the next coming year that it is more expensive than hiring somebody in-house, but it's worth a comparison. The other thing I recommend from a salary standpoint is before you, drop a big salary dollar on someone, hire them for a singular project. Identify an individual project in your environment and then evaluate the return on investment for that project. Offer some training to reduce the salary outlay. What I mean by that, and Cherie will probably address this in her section of this presentation, offer training to reduce salary means if you've got an EMR in place in your environment or a certain technology in place in your environment that particular skilled professional might be interested in, you can look to entice them by offering them training in that product. Epic is a popular one, for instance. If that person is going to be receiving training in your relationship with them, they may adjust for that in their salary requirements. The other thing you can do is seek out new graduates and train them for a certain level of advancement, and you can hire for your high priority needs and outsource some of the outside or more expensive components of the work that you need throughout the year. And finally, as part of my addressing challenges issue, I recommend that you set up interviews across several departments in your environment. Ask to have, this is my favorite one, and this is something that these 2 points, when you're trying to figure out if you've got a good personality fit in your HIT professional, ask to have the candidate teach you something technical. Whether they're going to be a trainer or not, this will help you identify somebody that's going to be a good communication fit for your group. Ask them to teach you something, and then additionally, ask them to teach a technical concept, to your most technically challenged employee. This is a great way to weed out the geek speak. Consider a group interview. Bring in multiple technology candidates at once. And what I found with, from an employer standpoint in that delivery of a suggestion is that in a group, often these technicians will present their leadership capabilities and start to coordinate in terms of their presentation. So consider a group interview when you're engaging HIT professionals. Additionally, set up a Helpdesk test. And what I mean by that is if you are hiring somebody in the technical space, particularly for a support position, have them call in from home and help you with something over the phone. This can often help you weed out folks that are particularly bad at delivering helpful information in a simplified way to medical professionals. And additionally, as I recommend to all of my staff folks who are hiring in their departments, always engage in multiple interview sessions with a candidate. Never assume that after one interview this person is the right person. You will find that on any given day they're going to be a strong candidate on day one, and on day two a couple of other people interview them and have more challenging questions and they don't do quite as well. So definitely engage in multiple interview sessions. And with that said, that leads into why we invited Cherie in to this Learning Lunch session this month, and that is to talk about how best to interview technology candidates. So now I'm going to turn it over to Cherie and mute myself to talk about strategies for interviewing candidates for HIT roles.
Thanks, Wendy. Hi, everybody. I wanted to just take a moment to thank everyone for spending a little bit of time with us today. I'm basically going to talk about telephone interviewing. In this industry, primarily the initial interview is done over the telephone, so that's going to be my focus. I'm taking, my points from not only my own experiences, but those of hiring managers I've spoken to over the years, and also feedback I've received from the candidates. So initially, what I'd like to start with is just timeliness. There's a lot to be said about being on time. Since conference lines are often used for telephone interviews, the person conducting the interview should ideally dial in a few minutes prior to the call, because most candidates will dial in 1 or 2 minutes early. By dialing in prior to the candidate, you can be prepared and avoid any potential need for rescheduling. I've frequently had times where a candidate's dialed in, the person who's conducting the interview has dialed in a few minutes late. By this time, the candidate's hung up. Then it's trying to correlate everybody to get back on the line, and oftentimes this results in rescheduling, and initially is a real waste of time for everyone who was supposed to be on the call. So it's the best way to avoid those circumstances is to be a bit early. If you're going to be late, you definitely want to send an email communication or a phone call, or have someone call the candidate and alert them to that fact so that they don't hang up and hang on the line or dial in at the appropriate time if you're going to be late. If the candidate is late and is not provided prior notice to you, this should obviously be considered as a red flag. You always want to provide someone the benefit of the doubt, but first impressions are important. So if a candidate is late dialing into a call, that's obviously a poor first impression. I'm a big fan of an upfront agreement. And by upfront agreement, what I mean is that you're going to let the candidate know as soon as possible that there's a limited time available for the call, and that you want to make sure that you're letting them know what that time is, what's allowed. Hopefully everybody can hear me okay. I'm getting some kind of weird recorded noises. So before getting to the meat of the interview, reiterate the duration of the call. This will hopefully keep everyone involved, on track, and focused. A good example of how to maybe address an upfront agreement is say thank you for your interest in taking a time to speak with us today. We only have 30 minutes for this call today, and we have a lot to cover, so let's get started. So in that, you've shown appreciation for the person talking to you, but you've at the same time let them know you've only got 30 minutes, you've got a lot to cover, so let's stay on task and not get off on rabbit trails, which happens a lot during interviews. Another trick in saving time is sticking to a format. Have an already established document that you utilize for every interview. It can include the candidate's name, the date of the interview, what that candidate was interviewing for, and then also allow you, note spaces to take notes throughout the interview and keep you on track in regards to what questions you want to ask and get answers for. We want to talk about an initial greeting as well. It's very important when you get on a call with someone that you not only introduce yourself but also reiterate what your title is. Depending on where this candidate came from, if you didn't already originally speak to them yourselves and they came from maybe a staffing firm or an outside recruiter, they may not know your exact title, so it's best to give a description of your title. If you have a panel interview and there are other people on the call, you'll want to do the same. Provide full name and job titles of each person, and have each person say hello afterwards. I've often heard from candidates who are on panel interviews that they get confused because different people are talking to them at once. They don't recognize the voices. They don't know what name to put with what voice. So definitely want to introduce everyone on the call, give them a moment to speak so that there's some voice recognition. Now, in regards to providing information, Also follow the introduction and open up the conversation with something about your company, information about the selling points of your company or your hospital or your healthcare system. What are the hot topics? What sets you apart from someplace else that candidate may want to work? Do you have better benefits? Do you allow that candidate to work from home sometimes? Is there in-house daycare? Any of those things that really set your company apart, you'll want to mention. And then follow that up with the job description. After the introduction, discuss the title of the job the candidate's applying for and provide an outline of the scope and responsibilities for the role. This information should have definitely been provided to the candidate prior, but you want to reiterate it to make sure that they don't have any questions. So ask them if they have any questions about the role and get that out of the way right away. If they do have questions, there might be make it or break it questions, and you can end the conversation early and save everybody a lot of time if this particular role is not the right fit for the candidate and that had not been determined prior to the call. So you'll want to discuss your company background. And after you've gotten all that out of the way, ask questions like, after reviewing our website, what did you see that interested you about coming to work for us? Because you're going to automatically assume that any good candidate is going to take the time prior to the call, prior to the interview, to review the website and really learn something about your company. So in order to drill down on whether or not they've done their due diligence, that's a good question to ask. You'll also want to ask open-ended questions. Open-ended questions are questions that don't require a simple yes or no answer, something that they have to explain. Always try to ask these open-ended questions. And a good example of an open-ended question is tell us or tell me your experience with XYZ company and what you learned there. So you're going to refer to the candidate's resume. You're going to ask them about any prior company and ask them what they learned at that specific company. That will allow you to learn more about what the candidate is picking up from their previous employers and feedback on whether or not it's a negative or positive response. If you're trying to draw more out regarding the candidate's personality, try questions like, when you aren't working, what do you like to do? Or, how do you think your previous manager would describe you? That's always a good question, because if they get stumped from the very beginning, you know that there might be an issue with their previous manager's impressions of either their work or their personality. Try to stay away from the question that seems to be used very frequently, and that is, tell us about yourself, or tell me more about yourself. The problem with that question is it's too open-ended. It often sends candidates off into unnecessary rabbit trails, and I have found that a lot of candidates are completely stymied by that question. They really have no idea how to answer it because they don't know where to start. Am I supposed to start with my education, my childhood? Are you interested in my work experience? Are you interested in what I like to do on a personal level? So try to stay away from tell us about yourself and make it a little more specific. Use variations like, tell us why you enjoy this industry, or please describe how you ended up working as an RN. Things that direct them to a specific timeline in their life and that they can narrow down and give you an answer for. Definitely be specific. When employers come away from an interview feeling bewildered about a candidate, why that person maybe looked good to them initially but now doesn't look good anymore, a lot of times this has to do with miscommunication. So the more specific your questions, the more specific the candidate's answer should be. Specific questions, again, would be something like, why aren't you working for XYZ company anymore? Or when was the last time you used a specific skill? You want to drill down and be specific. And if you're not getting specific answers when you are asking specific questions, that obviously should be a red flag. So what do you want to look for when the candidate is answering your questions? Well, by knowing what the cues are to look for, that will help you more easily determine whether or not the candidate will potentially be a good fit for your team. If a candidate is roaming off on rabbit trails like we discussed before, doesn't seem to completely answer your questions, definitely be honest with this person and speak up. circle back to them and say, you know, I'm really sorry. Maybe you didn't understand my question. What I wanted to know was, and reiterate the question again. However, if the candidate is repeatedly talking in circles, hedging questions, it's likely they're not qualified for the job, and you would want to move on and look at other candidates. If a candidate provides answers that are too short, ask them to elaborate. You might say something like, I know our time is limited, but I'd like to know more. Could you please elaborate on that for me? Keep in mind that many people find interviewing to be like taking an exam. They become nervous. They feel like they're in a pass-fail situation. I have literally had seasoned candidates that have over 20 years of relevant experience and exceptional references get passed over simply because they didn't interview very well over the phone. I've also seen junior candidates that really weren't qualified for positions get hired because they were a master at interviewing, only to have the employer let them go in less than a year because they weren't able to perform the duties of the role. So the best way to avoid these common mistakes is to check references. If you have a candidate that has an outstanding resume that you just weren't sure about over the phone, call and check references, and not just their references. Look at their resume. See if you know someone who has worked somewhere that they used to work. Call that person that you know. Ask them for an off-the-record opinion of that particular person. On the flip side of that, if you have a junior candidate who is really interviewing well and really impressing you, have someone re-interview them and drill down on their technical skills before you make an offer. So just don't jump the gun. Put the candidate through that technical interview, drill down on their qualifications to make sure that they have at least the minimum needs so that you can proceed with them and maybe provide them with some training. It does take more than a great personality to be a great fit for most positions. So more questions that you might want to ask that are good questions in drilling down. Open-ended questions that we discussed previously, obviously. Specific questions, as we also discussed previously. Drill down in the candidate's qualifications as related to the requirements of the position. Make sure that you're asking technical questions. Drill down on what type of environment they feel they thrive in. Does this person work better in a team environment? Do they work better independently? Do they like working remotely? Are they great at being on site, in a crowd, in a busy environment? So ask them what they feel they thrive in. Drill down on what's motivating the candidate to find a new role. Sometimes you find out more than you ever wanted to know about the candidate by just asking that simple question. If they go on into a 10 or 15-minute tirade about how their current situation stinks and why it stinks and their manager is awful, they may not be the right person for you to hire. Drill down on what it is about their current position, if they are currently working, that is creating their desire to find a new employer. So that is another question that you might ask. If they're currently working, what specific thing is driving their desire to find a new role? Is it money motivated? Are they motivated by new responsibilities? Were they promised something at their previous or their current employer that the employer didn't follow through on that you might be able to provide for that candidate? And you also want to know how to weed out subtle cues that could be red flags. As discussed above, if the candidate is evasive, they're talking around specific answers, this normally means that they're outside their comfort zone, and specifically with knowledge and experience. If the candidate lapses into discussions about their personal life in a negative fashion, complains in detail about previous employers, spills their guts to you about how horrible their recent divorce is and how they just can't function, those are obviously red flags. If a candidate seems easily confused, changes subjects rapidly, gets off on unnecessary tangents, and just doesn't seem to be able to focus, that is definitely a red flag. And if a candidate discusses in great detail their political, religious, personal viewpoints on specific topics that really probably has limited bearing on their job responsibilities, this is obviously another red flag. Now there are, and many of us know this, so I'm probably just reiterating facts that you're already aware of, but there are a lot of guidelines in regards to human resources and things that you should never ask, specifically due to discrimination lawsuits and things of that nature. Obviously, you should never ask questions about a person's health, marital, religious, sexual, or family statuses or opinions. You should never ask a candidate if they have disabilities. However, you can ask a candidate, once you've described the job position to them, whether or not they're capable of performing the position you described. If they mention that they have a specific disability, then you can inquire to them how you might be able to accommodate that specific disability, like wheelchair or something to that effect. If a candidate divulges personal information about their sexual preferences, health issues, etc., these items should not be noted in the candidate file or in the interview notes. And you can also mention to the candidate, it's not necessary for you to discuss that information with me unless it has an immediate bearing on your ability to perform the duties of the job. So definitely check with your HR department if you're not part of the HR department, and make sure that you're not asking questions that are, for legal reasons, going to maybe get you in a bind. Etiquette is another thing. There's specific etiquette. The old rule on, when you're engaging in conversation with someone is to treat others as you wish to be treated. This is important. Try not to interrupt your candidates. If you have a question that relates to what they're saying, jot it down on that document, and when they've done speaking, come back to it. Remember to provide that upfront agreement at the beginning of the call. When there's about 5 minutes or so left of the call, let the candidate know, time is running out. We only have a few more minutes. This is what I want to make sure we cover before we get off the phone, so they understand what the timeline is. And if they're absolutely not a fit and you've determined this early in the call, don't waste anybody's time. Just let the candidate know that you appreciate their time, but you've spoken to another candidate that you feel is more qualified, and get off the phone. And another thing that I guess is a pet peeve of mine is if you need to yawn or discuss something with a coworker or sneeze or there's other interruptions going on, mute the phone so that the person can't hear that on the other line. When ending a call, always thank the candidate for their time, and provide them with a clear outline on what to expect regarding follow-up. So let them know you're going to receive an email from me, or you're going to receive an email from so-and-so, and they're going to let you know what your next steps are. You're going to get that email within 48 hours, or we're going to call you back and schedule your next interview with such and such within 48 hours. Make sure that they have an understanding of where they're going. And if this particular candidate has come from a recruiter or a staffing firm, make sure to follow up after the call with that staffing firm. We like the candidate, these are the next steps, or we didn't like the candidate, and you can let them go. So that candidates are kind of hanging in the wind waiting to find out from you weeks later whether or not you plan to move forward. Obviously, in our industry, strong candidates don't stick around very long. So moving the process forward quickly and efficiently is very important when it comes to hanging on to those really good people that you want to hire. And then the post follow-up. Email the candidate, thank them, let them know what's going on. I really suggest that any follow-up should be made within 48 hours of an interview. Anything longer is running the risk of having that potential candidate have interviewed with 3 other companies and be moving on with another company before you have the opportunity. So to wrap this piece up, be flexible. Realize that the dream candidate that has all the talents and qualifications that you're seeking may not exist. Look at the salary range you're offering in comparison to what maybe they're seeking. Look at whether or not you can offer, as Wendy mentioned earlier, certifications, ongoing training that might sweeten the deal, or potentially some remote work, which has become very hot in this industry lately. Be aware of what qualifications that you're willing to, be flexible on. Take a look at some of the things that you think might let go if you're able to find someone that has, specific needs that just have to be filled right away. And none of us, I don't care how many years you're in this specific industry, none of us are going to hire the right people 100% of the time. We are all going to get fooled once in a while and hire someone that we thought would be excellent for the job, and then ends up that we're just completely disappointed because there's no fail-safe method. Don't let those instances shake your confidence. By following the steps we discussed today, you should be able to increase your number of successful placements. So with all of that information that Wendy and I provided, we're going to kind of open up the floor and see if anyone has any questions today.
Well, I am going to hop back in here. Cherie, thank you very much. Obviously, that's hopefully very enlightening to people who are in the process of trying to hire these elusive HIT professionals in the industry. Clearly, in an hour's time, we can only cover so much information, but we do have a few questions here, Cherie. One question is, do you find that employers value the current industry certifications like the RHIA and the RHIT from AHIMA? From an employer's perspective, I can tell you that I do tend to appreciate those additional certifications and credentials from folks looking for employment with my company, although my situation might be a little bit unique in that I'm actually looking for people with as much knowledge as possible in the EMR and HIT universe because of the nature of EMR approved and that business. However, Cherie might have a different thought on that as it relates to some of the employers that she hires for.
It doesn't hurt, certainly. You know, having that extra training and those extra certifications never hurts. I will say that what I find consistently in the industry is the more important certifications are the ones that are technical in nature. So, you know, Cloverleaf certifications or Epic certifications or Citrix certifications, those are the ones that the employers demand. The other ones are sort of just like icing on a cake, like, oh, they're this, but they also have that, or they've gone to school for this. So it definitely doesn't hurt, but it's not necessarily something that's in high demand. It's more the technical certifications.
Yeah, I agree with that. I have another question here that's similar and relevant, and which is even strong candidates with high-tech certification don't always have vendor-specific certification, which is true. And the question is, and it's a sad answer, I'm afraid to tell you. The question is, how can I get vendors to offer certification training? As Cherie will also attest, I'm sure, the vendors do not, at least at this time, do not seem to want to offer independent training options in the marketplace. They are primarily offering training only through the various employers. So if you can engage in a relationship with that employer that has access to that vendor-specific certification training, obviously that's the best way to get that candidate trained, for future potential opportunities. So that's not I realize that's not a very encouraging answer, but another question here is, does EMRapproved offer any training sessions on vendor software like Epic and Cerner and Allscripts and NextGen and eClinicalWorks? EMRapproved, first of all, no independent company outside of the vendor companies themselves can offer training in those specific products. It is not permitted, particularly by most of the major vendors that you mentioned there. However, in the ForMed-Pro network, which is one of our partner sites that is designed specifically for HIT and EMR professionals, and that is at the address, the number 4, medpronetwork.com. At that site, we do have an opportunity for members in that community to train one another. It's called the Member-to-Member Training Program. Many of them do have specific EMR skill sets, and in fact, we just launched that program last month, and one of our members launched an introduction to eClinicalWorks for other members. We had a lot of participation in that program. We will be addressing most of those other products that you have listed there in that member-to-member training program in the new year. So we've tested it. Everybody liked it. It went very well. So if you want to check that out for some more vendor software specific training, it is not licensed training from the vendors or certification training from the vendors, but it is a way for your candidates to get up to speed and knowledgeable potentially on some of these products in an exchange of knowledge between the members, and that's at formedpronetwork.com. What if a candidate shows false experience? Somebody's asking, Cherie. What's your advice in that situation?
Well, that again goes back to just making sure that you've got, if you are not technically savvy. So if you're interviewing a candidate for a role that you don't have a full understanding of the technical requirements for that role, make sure that you have a secondary interview, that you have that candidate have a secondary interview with someone who does know the technologies, who can really talk tech with that person and drill down as to whether or not they have falsified information on their resume. You definitely want to make sure of that. It does happen. It's not unusual in this industry, so make sure that you have them speak with someone on a technical level to weed out. And I know Wendy and I had discussed this earlier. I had a very Epic savvy person who used to conduct interviews on Epic experienced people, and if he had a feeling that that specific person was falsifying information, he would actually make up an application, and he'd say, tell me how much experience you have with Epic Eagle, and Epic Eagle doesn't exist. So if that person said, oh, funny, you caught me, then he'd know that person sort of knew what they were talking about. On the other hand, if he got a long-winded response about how much experience they had, he knew right away that they had falsified information, and then he just, disqualified them.
Yes, and I think, unfortunately, this industry is complicated enough that, if you're not very familiar with technology, you can definitely, you'll definitely find that folks can impress you with a limited amount of geek speak. So, validating credentials is extremely important. We have a 1099 service network in my company for HIT professionals, and so we do a lot of vetting and validating of candidates, and all of that is an extremely important step, obviously. The last question that we have here is, how much emphasis do do employers put on English language skills? This particular participant in the webinar sees a lot of good candidates, but they don't have great English skills or communication skills, which can kind of screw up the hiring process. Any thoughts on that, Cherie?
Yeah, I have had some really fantastic and very experienced people get passed over because speech was a bit of a barrier. And I would say for some of these people, I'd go out on a limb. Usually when they're communicating face-to-face, it's much better than over the phone. And also, most of the time their written communication skills are exceptional. So in my opinion, if you're finding someone with the technical qualifications you're seeking and the only barrier is that maybe they're a little bit difficult to understand, I would definitely move forward with that candidate and work with them. You can do that on a professional level in regards to their communication, to teach them to slow down when they're speaking and to let them know that you don't understand. But yes, if they've got the qualifications you're looking for, it's worth moving forward with them.
Well, that was our last question in the question bar, so I very much appreciate everybody's attendance in this session today. If it was helpful to you, then you might want to visit Cherie's blog. She does offer a lot of great advice in terms of the hiring process and interviewing process in HIT, and that's at engagemehit.blogspot.com. I will be sending out a follow-up email to all of the attendees in this program today with a link to the YouTube channel recorded version of this session that you might want to share with colleagues or other folks in your environment, and then also a copy of the PDF presentation as well. So again, thank you very much, and thank you for thanking me. I see some of you in my question box, and we hope that you enjoyed it, and we look forward to having you come back in January for our January Learning Lunch session, and have a wonderful holiday season.
Yes, happy holidays. Thank you.